For young people growing up in Boston, public health can be one more indicator of social inequality, but it can also be an opportunity for careers and even leadership. Those opportunities can be explored in a career event on Saturday, April 7th, sponsored by the Harvard T.H. Chan School of Public Health. To tell us about the event is a doctoral candidate from the school, Tariana V. Thank you very much for being with us, Tariana.
Thank you so much for having me, Chris.
Well, this is an event, I guess, mainly for high school students. And I guess if you're talking to a student and the student says, what is public health and why does it matter? What would you say?
Public health is everywhere. It is the art and science of where we live, where we work, where we play, where we age. And so if you look at where we live and where we go to school, where we work, everything, you see public health.
And of course, what about your own growing up in Boston? You grew up in the neighborhoods here. Talk about your experience going from living someplace with public health problems to that first step on a career.
I grew up in Dorchester on Dudley Street, and it's a community that is plagued by low income and limited opportunities for advancement. And I was fortunate that in my high school year, I did a summer internship at Beth Israel Deaconess Medical Center as part of Social Latina's health careers program. And I got exposed to working in healthcare, but I didn't yet see myself as someone who could actually lead or make a meaningful contribution. And it wasn't until undergrad where I said, I could use research, I could use science to be able to study the factors that affect people's health and then create solutions where we can help them be happy and healthy. And so once I discovered that, I said public health is for me.
Well, I know some people say, well, if you're talking to teens, a teen issue in public health, well, teen pregnancy, but it can also be violence too, right?
Absolutely, community violence. And looking more broadly at what violence is, it's not always just physical, like gun violence, but it can be looked at as poverty and the effects that that has on people's bodies and psychology. And so one of the things that is part of my mission as a public health leader is to promote education, because through education, we're able to have more life opportunities, more sense of power and decision making in our lives, and that is public health promotion.
Well, the other thing about public health, it's not just getting some big entity with lots of resources to come in and cure a problem or clean it up. I guess it's about people inside the community themselves changing the culture.
Absolutely, and that's also been part of the work that I do, and what attracts me to public health is that there are multiple points of entry, and we find a lot of solutions and a lot of richness can come from the communities that are most affected by the issues that we study.
What about the opportunities that young people are going to be getting a taste of, at least at this event in April?
We're hoping to have workshops and speakers there and have them see the potential of public health, that they themselves, even as young people, can contribute. We're going to have peer educators, so high school students who are doing the work be able to lead workshops and role model as well as educate other youth as to what you can do in public health.
What do the teens get from that? You know, you're a peer leader, you know, you're 16 or 17. What does that do for you by the time you're 19 or 20?
When I think of that, I think about my high school self and what would I have wanted. I would have wanted other people who are young like me that are in positions of power or influence or doing something active in the community. I want to be able to say, I can be that too. Or 10 years from now, I could do that. When I was in that summer internship over 10 years ago, I thought that my role was just being an administrative assistant in a hospital. Now, as a doctoral student, I can see I can lead that hospital. So if I'm able to show these youth that you too can be leaders, you can be influencers, you can be change agents in your communities, that I think is the most powerful way that we can give something to the youth who attend.
Going back to that internship, I'm guessing there was maybe some mentoring going on, even if it didn't start that way?
There was mentorship more on an organizational and peer level, but when I was in the hospital, there was very little limited sort of mentorship or relationship. But I just remember that it gave me a lot of pride to be able to have a job. But like I said, I never thought I could take it somewhere big. And so now that I'm in a position where I come from the communities that these youth are coming from, and I'm able to make a difference, I want them to see you too can have this path.
I do have to ask you one more thing, and for young people who hear about, you know, public health and health centers and hospitals, and they think, you know, I struggle with STEM subjects. I don't know if I can do this. What would you say to that kind of a person?
There's so much more than STEM. You can be a business person creating products that can help the environment or that can promote health. You can be a teacher. and educate the next generation. And we know that once you're educated and have that passport of diploma, you have a limitless opportunity for advancement in our society. You can be an architect and design green spaces that can promote health and contribute to the environment. There is a wide variety of things that you can do with public health that is beyond science and math.
We should mention for people who want some more details about this summit, you've got a web page that they can look at?
Yes, so you can search on Facebook for Youth and Public Health Summit, and you will see our public Facebook page and then information with flyers and links to registration.
And of course, it's going to be, what is it, April 7th, and time and place exactly?
So it's going to be at the Harvard Chan School of Public Health, 677 Huntington Ave, from 9 to 3.
Thank you very much for being with us.
Thank you so much, Chris.
Tariana V from the Harvard T.H. Chan School of Public Health. Up ahead, the report from Dorchester with Jennifer Smith.